morning, ladies and gentlemen. This is Aisha Shehi, a health coach from the National Health Insurance Company, Dhaman, and I am part of the disease management team. Thank you for joining us today in Ramadan webinar. We welcomed Ramadan several days ago. May you and your family have a blessed and a peaceful holy month. Ramadan is a special time for reflection, self-improvement, kindness, and fasting is one of the key pillars of the holy month. Dr. Mumtaz Meeran from Abu Dhabi Public Health Center will take us in a journey to explore health benefits of fasting. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end of the session to answer these questions. Without further ado, let me introduce our presenter for the day, Dr. Mumtaz Meeran, Senior Specialist from the Department of Health Promotion in the Abu Dhabi Public Health Center. Dr. Meeran has over 15 years of experience in public health, leading on a wide range of public health priorities in the UK. She has a master's degree in public health from the London School of Hygiene and Tropical Medicine. Dr. Mumtaz, welcome. The floor is yours.
Let me unmute first. Thank you so much, Aisha, for the wonderful introduction, both to Ramadan and to this morning's session. If you will allow me a minute, I'm just going to start sharing my presentation. Just a second. I hope you can see my presentation on the screen. Following on from Aisha's wonderful introduction to the session, good morning, everybody. My name is Dr. Mumtaz Meeran, as Aisha said, and wishing you all a very wishing Ramadan Kareem, and hope the fasting has been going on well for you so long, the last 4 days. So today's session, we are going to be looking at the health benefits of fasting, and then also looking at some how to maintain a healthy lifestyle during Ramadan. So this is what we will be looking at, the content or the outline of today's presentation. We will start by looking at Abu Dhabi Public Health Center, followed by some information on the benefits of Ramadan and fasting, and focusing particularly on how to take care of or what people with chronic long-term conditions need to do during Ramadan, as well as the major health benefits of fasting. Finally, we will finish off with some information on following a healthy lifestyle during Ramadan, which is applicable for all of us, regardless of whether we have any chronic condition or no. So very briefly, this is His Excellency Matar Saeed Al Nayomi. He was the Director General of the Abu Dhabi Public Health Center. The Abu Dhabi Public Health Center was established in 2019, a mere 6 months apparently before the COVID-19 pandemic that came upon us. And the entity was established to ensure a public health system that maintains the health of the population in the Emirate. And we are very honored and very proud to say that the Abu Dhabi Public Health Center is the first of its kind in the region. And what is our vision is towards a healthy and safe society. And our mission is to enhance the health of the population in Abu Dhabi and ensure the safety of everyone in Abu Dhabi with the highest levels of innovation, excellence, and creativity. And we are located at the Siemens building at Masdar City. We have made this move very, very recently. And these are some of the strategic priorities of the Abu Dhabi Public Health Center in terms of having a governance and management, encouraging the community to practice a healthy lifestyle, focusing on the health and safety of workers, improving the quality of life, building and developing a sustainable national capacities in public health, and finally develop decision-making with early warning, innovation, and artificial intelligence. Now we go on to speaking about Ramadan and fasting. Now, in terms of the introduction, I'm sure you are all aware, and maybe you can educate me on this, which is that the holy month of Ramadan is a very special time in the year for all Muslims. It is one of the 5 pillars of Islam, and the aim is to teach the practice of self-discipline, self-control, and sacrifice. And as we all know, fasting is a complete abstinence from food and water between dawn and dusk. And Muslims all over the world do prepare themselves mentally and physically for Ramadan. Now, do remember, if health, this is a very key point that I'm going to say next, which is if healthy habits and behaviors are maintained during the hours when eating is permitted, fasting can have many health benefits. I cannot stress enough on the importance of this last sentence that I just said, which is what you do when you are not fasting, that period from iftar to suhoor the next day. What do you do at that time will have a direct impact on what benefits you're going to reap from fasting those long hours in terms of health. So health during Ramadan, do remember that according to the World Health Organization's definition of health, it is not just merely the absence of a disease or infirmity. What they mean by health is a more holistic definition, which is a state of complete physical, mental, and social well-being. And do remember, health is a key to happiness. And indeed, there is no wealth without health or something like that. I do remember there is a quote like that. So health is the key to happiness, and what we consume directly has an impact on our health. So you can also think of Ramadan as a great opportunity to focus in bringing back a balanced and healthy lifestyle, to your lives. Through fasting, you can learn how to manage your eating habits, how you can improve self-control and have a more disciplined lifestyle, in terms of focusing on your sleeping habits and so on. So think about Ramadan. Yes, there is a whole spiritual, religious, it's the most blessed month, but also you can use that as an opportunity to take control of your health and put into place a lot of things that will be easier because you're using this as an opportunity to inculcate into your everyday life. So what are some of the major health benefits of fasting? Now, I'm sure you all may be aware of the whole trend of the intermittent fasting that is very, very trendy and in the news very much the last couple of years. And there is a whole lot of research that is being done around in terms of fasting. And the important thing to remember is fasting in Islam has been practiced for, very, very, very many years, as well as other religious practices, cultures, they do promote fasting as well. Although in the scientific arena, with the advent of intermittent fasting recently, there has been a whole lot of research that is being done to look at the health impacts of fasting. So some of the major health benefits, and when you are reading this and listening to me, do remember that one very important sentence I said at the beginning of the presentation, which is what you do in your non-fasting hours is directly proportional or will have a direct impact on the health benefits you're going to reap from fasting. So some of the major benefits: optimizing energy metabolism and giving your digestion and your stomach a break from the constant work that it's doing. Fasting has been shown to reduce insulin resistance. So insulin resistance, which is like, there is a lot of circulating, insulin in your bloodstream, and then resistance because your muscles are not able to use up the insulin correctly. And, that's what, it's one of the reasons for leading on to diabetes and the cause for type 2 diabetes. So, fasting definitely reduces insulin resistance, and, it also controls or brings down your blood glucose levels, thereby controlling diabetes. Fasting has also been shown to boost brain function as well as prevent some neurodegenerative disorders such as Alzheimer's, although there is more research needed in terms of preventing neurodegenerative disorders. A lot of the studies that have been done in animals do show that this is what fasting does to us. It reduces inflammation and oxidative damage. Now, acute inflammation is okay. That's when, like, something happens, there is an inflammation and the body responds to it. But chronic inflammation, that has been linked to the development of many long-term conditions. Thereby, so fasting thereby reduces the levels of inflammation in your body and prevents any sort of oxidative damage. Of course, it enhances the heart health. How does it enhance the heart health? When you fast, there is an improvement in your blood pressure, in the levels of cholesterol and triglycerides, which have a direct impact on your heart health. It promotes weight loss. Yes, because you're not going to be eating during a certain period of time, eating or drinking. But of course, if people are going to, compensate or overcompensate for those fasting later on when they can eat, they are not necessarily going to notice any weight loss, but it does promote weight loss if done correctly. And fasting also improves mental health. I think it's quite important to look at that as well, because the whole concept of mental health, we will talk about it in the healthy lifestyle. But I just want to add a point here, because we're speaking about mental health. One of the key, emerging or thing that is often spoken about in the world of mental health is something called resilience, something called discipline and so on. And fasting really makes us more resilient to things. It makes us to cope with, discomfort, because, we are doing something until, the right time is there for us to break our fast. So the tips and tricks that we learn to keep ourselves well and good during fasting will obviously have an impact on other areas of our lives, or we can implement these things in other areas of our lives. Now we go on to talking about the chronic disease management during Ramadan. Now, do remember, when we say chronic disease, we speak about people who have diabetes, who have high blood pressure, who have heart disease, kidney disease, and so on and so forth. So do remember, fasting from dawn to dusk can be challenging for those who have chronic conditions. If you or your family member or you have friends, they have chronic conditions, do remember it is important to take special care during Ramadan. If you do have any chronic conditions and you are planning to fast during Ramadan, please remember it is very important to visit your doctor and plan for this before. There was a study that was done in Cleveland Clinic in Abu Dhabi. I believe it was in 2021. The results were published that showed over 49% of the patients who have chronic conditions do visit their doctor before Ramadan, just to make sure that they can check their plan, that they can fast, that fasting is not going to have a negative impact on their existing condition and health, and then guided by their doctor, they go on to then fast during Ramadan. A lot of the times, because with people do want to make sure that they are able to fast during Ramadan, that people sometimes tend to not to take that much they don't consider their health that much, because they are so enthusiastic and they really believe and they really want to fast during Ramadan, because they want to reap the benefits of fasting and everything else in this blessed month, that they tend to put their health on the back burner. Now, that is not the right thing to do. So if you do have a chronic condition and you find fasting challenging, or even if you don't find fasting challenging, apologies for that, make sure you visit your doctor before Ramadan. Now, I do know we are having this this presentation during Ramadan. It's not too late. Make sure, if you haven't visited your doctor, you do visit and have a consultation with them, so you can fast the rest of Ramadan in a manner that doesn't have a negative impact on your health. So tips for diabetes management during Ramadan. Now, obviously, diabetes is one of those really key conditions, and it is one of the most commonest conditions as well, especially in the UAE, that we will just talk about, top tips for diabetics during Ramadan. And diabetes is one of those conditions that is directly impacted, by what we eat and drink, and when we eat and drink, and our medications and so on. Remember, Do not stop your insulin or your medication, but do alter your dose and timings as advised by your doctor. Your doctor, the person who you go to on a regular basis, would be the best person to advise you on what you need to do, because they know your history, they know how your body reacts to, changes of doses, they know what happens. So make sure you visit them so they can advise you on how you can alter your medication or insulin to suit the fasting hours. You have to keep testing your blood glucose regularly. Do remember that this is not going to break your fast. So whatever is your routine for checking your blood glucose levels, you can continue to do that. Remember, it's not going to break your fast. While suhoor and iftar are the primary meals, it is best to have, try not to have two huge meals. Try and split your meals into three so you're able to eat a little bit, but during the day, you're not having two heavy meals. Again, try to have your suhoor meal as late as possible, because if you're going to eat really early, then the amount of time you're fasting is extended considerably. So try and have it as late as possible, because this will prevent any hypoglycemia, as well as, when your blood sugar tends to go low, and give you energy to sustain you throughout the day. Do remember to carry some dates, some sugar, anything that you carry, something that will give you a quick energy boost or improve your blood sugar levels very quickly, in case you experience hypoglycemia and need to break your fast. This is also really important, to make sure you carry something sweet with you, which is dates or sugar or juice, anything that is these are the things that will increase your blood glucose levels very, very quickly. So, you are prepared. So if you're going to experience any hypoglycemia and you have to break your fast, you're not really going around looking for things at that time, but you already have something with you. What about hypertension? Again, hypertension is one of those common conditions that we see quite widely. So it's basically you have high blood pressure, and hypertension just, untreated hypertension leads to severe health complications and increases the risk of conditions such as heart disease, stroke, etc. Again, if you do have hypertension, do meet up with your doctor before and ensure that you know when to take your medication when you're fasting, as well as drink plenty of water during the non-fasting hours. And again, similar to blood glucose, monitor your blood pressure regularly. And it is advised not to fast until your blood pressure is reasonably under control, like if it is going to be really high or it is quite fluctuating and so on. Now, we have just looked at diabetes and hypertension, but in terms of general tips on chronic disease management, obviously there are people who have neurological diseases, there are people with heart disease, with kidney diseases and so on, where hydration, drinking enough water becomes really important. So for whatever is the disease management, make sure, as I said, you meet your physician. But overall, in terms of the general tips, first thing is taking your physician's advice. And then the second thing is ensure that you follow a healthy diet that is low in sodium and does not include processed or fried foods. It's very easy to say, I know, come iftar, I know everybody is, running to eat fried foods. How much ever people say the day before Ramadan starts that how they are not going to eat fried foods this Ramadan, and then everybody does that every year. I do understand that, but as much as possible, avoid anything that is processed and any fried food, and lower your intake of salt. And drink plenty of water. So it's quite important to keep yourself hydrated so you don't get dehydrated because you're not drinking anything during the day. Make sure you drink plenty of water during, when you are able to eat. Although avoid sugary drinks because they are going to do nothing for you except increase your blood glucose levels. Avoid sugary drinks as well as diuretics such as coffee and tea, because what diuretics such as coffee and tea do is that they dehydrate your body. So they lead to but they're called diuretics because they lead to loss of water from your body. So if you're going to be drinking a lot of water, but then you're also drinking a lot of coffee and tea at the same time, you're not really hydrating your body. Do you see what I'm saying? You're sort of doing it in a bit of a, it's not really helpful to keep you hydrated. If any of your symptoms are worsening during this time, please seek medical attention immediately. Again, a lot of the times people are so committed and dedicated to fasting and reaping the benefits from the holy month that if they do feel any symptoms are worsening, they just try to think, oh, it's nothing. I'm going to wait and see when I break my fast. I'm sure this will go away and so on. Try not to do that and seek medical attention immediately. And finally, the most important, ensure you get plenty of rest and sleep. Fasting is hard on the body. We are not eating or drinking anything for a substantial period of time. And it does cause a bit of tiredness, fatigue, and so on. So make sure that you get plenty of rest and sleep so you can function better. So now we come to following a healthy lifestyle during Ramadan. So what do we mean by a healthy lifestyle? Now, do remember a healthy lifestyle is something that we all should be following all through the year, not just during Ramadan. However, as I said at the beginning, Ramadan provides us with a wonderful opportunity to take stock of our lives because we are already doing certain things like controlling what we are eating, not eating during certain time period, focusing on spiritual and religious practices, that will calm us and give us more, improve our mental health and well-being and so on. So utilize Ramadan as a great opportunity to take a stock of your lifestyle and where there are areas where you feel you can do more, improve your lifestyle, use that as an opportunity to put those habits and practices in place because by the time Ramadan finishes, it's 4 weeks and you've already been doing some of these things that, it can become second nature to you when Ramadan finishes. So healthy lifestyle is nothing but a set of practices that aim of which is towards enhancing your health and preventing diseases, thereby improving the quality of your life. So in terms of healthy eating during the holy month of Ramadan, make sure that your healthy eating, whatever you're eating at iftar and suhoor is moderate, it is balanced, and it is varied. Make sure that we are not going and eating, as we already said, a lot of fried food, sugary food, high fat foods. It's not a time, it's not a fast and feast. It's not that we have fasted for so long, now it is time to feast and we eat everything that we see on site. So it is not like that. Make sure that whatever you're eating, it is moderate, it is balanced, and it is varied. And also take into consideration your body's nutrient needs so that it has carbohydrates, it has protein, it has fats, it has, vitamins and minerals and fiber, which you will get from your fruits and vegetables. And then, of course, have sufficient water to keep yourself hydrated. Do remember these nutrients are really important for your energy levels as well as in children for growth. And also remember that you cannot have all your nutrients from one particular kind of food. So that's why you need to make sure your meals are balanced and they are quite diverse. You might have heard of the phrase called eat a rainbow. That basically means when you are choosing your fruits and vegetables, just make sure you're choosing a lot of colorful fruits and vegetables because a different color will bring you a different mineral or a different vitamin or different levels of some phytochemicals and antioxidants and so on. And that's why cutting out food groups is also not recommended. There is a whole thing with the low carb and people don't eat fat and people don't eat this and people don't eat that because they think that's going to help them. Everything, it's important to make sure your meal is balanced in the right proportion and it has all the food groups in it because that's what will give your body all the nutrients that it needs for it to function healthily. So when I say healthy eating, this is the My Plate model, which was developed. So a healthy plate ideally should have, if you look at a plate as a circle, So ideally, you would have a quarter of the plate would be your grains or starches, such as your rice, bread, pasta. That's your carb done. Then a quarter of your plate would be protein. Protein could be, if you're a vegetarian, a non-vegetarian, it would be your meat, it would be your chicken, it could be your egg, and so on. And if you're a vegetarian, it would be your legumes, it could be your cheese, and so on, and your lentils. So those would come in the protein. And then more than quarter, like, half of your plate, right? So you look at a plate and half of your plate must be filled with vegetables or with fruit, right? So more, so you sort of have your fruits and vegetables, but more than a quarter must be, there should be more vegetables than fruit. Let's put it that way, because fruits are really good. They are really healthy, but vegetables are more better for you. And, they are, fruits and vegetables, some fruits and vegetables, we also call it as, they have a lot of water in them, and they are called as high volume food. That basically means you can eat a lot of the fruits and you can eat a lot of the vegetables, and then the volume, it's going to make you feel fuller, but it's not going to give that much of calories, or, it's not going to provide more of those things. So that's why, like, it will keep you fuller, and a lot of the fruits and vegetables are also high in water, like your watermelon, cucumber, and so on. So that will also keep you hydrated. And also make sure that there is a source of dairy in the meal. It could be yogurt, it could be cheese, it could be milk, whatever is it. That would be your healthy eating plate. Now, what are the recommendations for healthy eating during the holy month? Again, we have seen some of these things before, but just in terms of eating the dates to break your fast is a cultural and traditional healthy way to begin your iftar. Choose whole grains, when you're choosing your starches, choose all your whole grain bread and starches rather than your white rice and white pasta. In terms of the protein, avoid fried, enjoy grilled meat or baked lean meat, skinless chicken and fish. So you're going to get your protein. Protein is really important for our body. Protein is something that is important for children for growth, but even for adults, because it helps us with muscle growth. It gets, we have this essential amino acids that we need, which we will get through food. Again, avoid fried and processed food high in sugar or fat. Again, during suhoor, make sure you consume the right food that will help you last through the day. So, things like, whatever you eat should be complex carbohydrates and protein. So they are going to keep you full for a long period of time, not something sugary that's going to spike your blood glucose levels. And then, there is a crash, in which case you are going to feel more hungry and tired during the day. So these are some of the healthy recipes that you can find at the Abu Dhabi Public Health Center's website, which would be, this is like a soup, a lentil soup, as well as, other recipes that if you would like, you can go and have a look at. As I said, visit the Abu Dhabi Public Health Center, because you have two, as you can see, there are two things. One is what is the original recipe, and then how can you adapt it to make it into a healthier recipe. And trust me, many times when we do make it into a healthier recipe, we don't even know what has been lost in the original recipe. We enjoy it equally. Then we come to physical activity. A lot of the times people do ask this question, how to be physically active during Ramadan? Is it important? Physical activity is very important regardless of whether it is Ramadan or not during Ramadan. So physical activity refers to all bodily movements, whether it is walking, cycling, sports, play, anything that you do that's going to, like, move your body and then, like, make, spend some energy and, like, use your skeletal muscles as physical activity. Physical activity has innumerable, benefits on your health, reducing your risk of heart attack, helping you manage your weight along with a healthy diet, lowering your levels of blood cholesterol, lowering your risk of developing type 2 diabetes and osteoporosis. And also physical activity improves mental health and well-being, because when we are physically active, we release these feel-good hormones that put us in a better mood and makes us feel better. So the general recommendation for physical activity is at least, that means you can do more, but at the minimum that is required is 150 minutes of moderate intensity physical activity each week, and which is equivalent to 30 minutes of physical activity 5 times a week. That's it. And when we say moderate intensity, you have to be, it's not something that you can do very easily. It should be like, you should be able to speak, but like, you should be finding it a bit of a challenge to speak, and you're sweating and your body is becoming a bit warm. So that is what we roughly say as moderate intensity. It can't be a very casual walk in the park speaking to your friend, which is really good. So if you're going to be meeting your friend at a coffee shop and having a coffee, you can actually choose to go for a walk, which is amazing. It gives you a physical activity. It is good for your mental health, and you can also catch up with a friend. However, if you're looking at it in terms of the recommendations for physical activity, you can still go for a walk with your friend, but it has to be a brisk walk, and you should not be able to have a conversation very easily with him or her, because you will be sweating, you will feel, your body will feel warm, and you will find it difficult to have a conversation. So that's the general recommendation. So in terms of during the holy month, again, like, hydration is important. Ideally, 2 hours after your iftar meal, you can, do some sort of physical activity. You can also, if you're doing something which is very low impact, you can potentially do it before iftar as well, because if it's going to make you feel better and not really put a lot of strain on you. And ensure again you get a good sleep and good food, so that, like, your body is prepped and your body is energized. And then, like, if you are not a trained uh, you're not an avid gym goer, and you don't have a whole lot of things going on, avoid intense workouts such as heavy weightlifting, long distance running, or intense speed. But again, be guided by your body. If you're something who does this all the time, you're really a fitness enthusiast and you're extremely fit, and you feel that you can do it, again, be guided by your body and what it is that you can do. This is in general the recommendation for everybody. Sleep, extremely important. I think, sleep has really come on the radar in terms of the importance of sleep. Previously, everyone only spoke about healthy eating and diet, but now, like, sleep is really, there is a lot of research, a lot of studies on the importance of sleep, because it makes, everything function better and it makes you feel better. So it's really important that, like, you get a good night's sleep. Yes, in Ramadan, our normal sleep schedule just does get disrupted because we are waking up, and then there are a lot of social gatherings and activities which often run late into the night. But it can, and it can upset our, our biological, or what we call as the circadian rhythm, and affect our health in many ways. So, but you have to practice good sleep hygiene. So what do we mean by that? Try and get consolidated sleep. So, like, longer blocks of sleep are more beneficial than multiple short naps. So try and see where you can sleep for a good few hours. If you have not slept well, if you're really tired, you can take a power nap. Even something like a 20-minute power nap in the afternoon, will help you get your energy levels back up and focus levels. Do remember, what you eat and drink will have an impact on your sleep. So if you're going to have a very heavy meal and then you're going to sleep soon after that, do remember your body, like, needs time to digest the food. And if it is too heavy, it's going to take longer to digest the food, and so on. Also, the right sleep environment. So a quiet and dark place is ideal. And of course, the bane of our existence in today's world, which is electronic devices such as mobile phones, laptops, and TVs, which we look into it all the time. And the blue light that emits from those, it definitely has an impact on the quality of our sleep. So I already spoke about mental health at the beginning of the presentation, but as I said, Ramadan does give us the spiritual power, to reflect on our habits and behaviors. So, in addition to avoiding unhealthy behaviors, also use it as a stepping stone to reset and build up resistance to triggers. So think, we already spoke about it. So think about those, how you can use it as a stone to build resilience and discipline in your life. And similar to what we saw for physical health, again, for mental health, the definition is not merely the absence of mental disorders, but a state of well-being in which an individual realizes their own abilities, they can cope with the normal stresses of life, they can work productively and make a contribution to their community. This is what is the definition of mental health. So these are some of the characteristics of good mental health, which is about building fulfilling relationships and having good self-esteem and having a sense of contentment and a sense of meaning and purpose in their lives. So things like volunteering, the charity that we do during Ramadan, all of that is actually good for our mental health and well-being. Stopping smoking. Now, if there is any time anyone has to stop smoking, it is during Ramadan, because you're already not going to be smoking for such a long period of time. It's just a matter of extending that further. So, you all must be aware of this, that tobacco is the world's leading preventable causes of death. It causes many diseases that affect the heart, liver, and lungs. It is also a major risk factor for heart attacks, strokes, chronic obstructive pulmonary disease, and lung cancer. And it is the main cause of cardiovascular disease and high blood pressure. So it is not good. And these are some of the harmful health impacts of smoking. We already saw that, such as high blood pressure, not being able to taste or smell well, higher risks of stroke, dental or oral issues, infertility, cardiovascular diseases, and cancer, and so on. So if you're already thinking about your Ramadan preparations, or now you're about 5-6 days into Ramadan, it is an ideal time to consider giving up smoking. You already are thinking about abstinence in your mindset, that you're going to give it up. So, all that you need is, this is already giving you the motivation and the stepping stone for you to quit smoking entirely. To quit smoking, you have to be confident and have the belief that you can do it. Think of what activities you will do when you stop smoking. That's quite important to be prepared. You can think about how beautiful your smile is going to be when you quit smoking. And you also need to make sure you avoid anything or anybody, I would add, that motivates you to smoke. I know it's not nice to give up on friends and family, but if your friends and family are motivating you to smoke because they smoke, until you get control, you're sure that you're not going to smoke, it's probably better to avoid those situations and people. So what are some of the treatments available? There is behavioral therapy, there is nicotine substitutes, pills, as well as other psychiatric medications. So this is a very interesting thing that I would like to say, that the health benefits of smoking occur very, very quickly. Within 20 minutes, your heart rate and your blood pressure, they drop. Within 12 hours, the carbon monoxide levels in your blood, they come to normal levels. Within 2 to 12 weeks, there is improved blood circulation and increased lung performance. 1 to 9 months, there are decreased rates of coughing and shortness of breath. And at the 1-year anniversary of quitting smoking, the risk of coronary heart disease is about half of that of a smoker. You have cut down your risk by 50% of coronary heart disease. At the 10-year, the risk of lung cancer drops to half compared to smokers, and the risk of cancer of the mouth, throat, esophagus, bladder, cervix, everything decreases. And 15 years after you've quit smoking, the risk is equal to that of a non-smoker. So that's really good. And these are the list of clinics that provide services that could help you quit smoking in the Emirate of Abu Dhabi. You can see that there are quite a few of the centers that provide these services. And finally, we have come to the end of the presentation, and I would like to thank you for joining me in today's presentation. I hope we have managed to cover the health benefits of fasting, what are the scientific and information that we have, the evidence that is there for us to, the evidence for the health benefits of fasting and Ramadan, followed by how to lead a healthy lifestyle during Ramadan, as well as, in terms of chronic disease management, the importance of visiting your physician, making a plan, and only fasting if you get the go ahead from your doctor to fast, and also putting things in place that will help you manage, any symptoms that you get. And if your symptoms do worse, to meet your physician immediately. Now I will hand over the stage back to the lovely Aisha. Thank you very much. And you can scan the QR codes here to visit Abu Dhabi Public Health Centre's social media platforms, where you will get a lot more information on maintaining a healthy lifestyle during Ramadan, as well as all the recipes and the tips and tricks that we discussed earlier on. Thank you.
Thank you, Dr. Mumtaz, for such an informative presentation. Now we will be moving to the Q&A section, and we will have 15 minutes to answer the audience questions. So for the first question, Doctor, what is the healthier way to break our fast? What's the healthy way to break our fast?
Okay, so the healthier way to break our fast, which what we discussed before, is like, having the 1 or 3 dates, which is what, the traditional and the cultural and the religious way to break the fast with some water. So that would be your good way to start breaking the fast, and then have anything like, you can have fruits, you can have like soup, whatever is your meal. Just make sure that your meal is balanced, it is varied, and it is healthy. Avoid any of the fried foods and processed foods. Avoid drinking frizzy drinks, because people do think fruit juices are very healthy, and they can have a lot of fruit juices, but they also come with it a lot of sugar, even those that say no sugar added. And then they also spike your blood glucose levels. So, whatever we said, like, have a balanced meal to break your fast, and also don't eat everything too much at one time. You can sort of spread your meals. So like, take breaks in between, as well as drinking a lot of water. Again, don't take sips during the time that you're not fasting.
And Doctor, regarding fruits, can we take only fruits for health and diet?
Can I ask repeat the question? You may not eat anything else, but just eat fruits?
Yes.
I don't know, no, Aisha, I will not recommend that, because fruits, yes, it is great. It's a great source of like, vitamins, minerals. Yes, there is carbohydrates in some fruits like bananas and, so on, but they don't provide you with the overall nutrients you need for your body's health and well-being. Your body needs protein, your body needs fat, your body needs like, other sources of starches. So you do need to eat everything in, everything together, which is what is going to give you all the benefits.
And regarding drinks and sugar in drinks, what is the healthier alternative to coffee?
Oh, the healthier alternative to coffee is like, you can think about, okay, if you really cannot give up coffee, you can try drinking decaf, but that's just a less deadly, a less alternative. You can go for teas. You can have herbal teas, you can have green teas. Those sort of teas are quite a good alternative, because they are still a warm drink. They are going to soothe you, but they are also going to like, not caffeinated, and they're not having any sugar in it.
And when is the best time to exercise in Ramadan? So is it during fasting or after breaking our fast?
Okay. Now, this is an interesting question, because I know that there is a lot of things in the media about, this working out in a fasted state and so on. Now, the best way, what we would recommend is that you exercise about 2 hours after you've had your iftar, after you've broken your fast. And this is assuming in that, in the breaking the iftar, in the iftar time, you're not like, stuffing yourself, eating too much, you're sort of going on with the balanced meal. So I think you've had something good to consume. So 2 hours after iftar is what, we recommend that people do any sort of physical activity. Although, if your physical activity is going to be something which is very low impact, like, walking, gentle walking, or you're going to do some yoga, or you're thinking about, doing anything which is like, not really intense, then you can potentially do it when you're fasting as well. Like, preferably do it just before iftar time. So then when you're done with your exercise or physical activity, it is time for you to break your fast. I think that's just in terms of logistics and making sure you're not tiring yourself so much.
And regarding suhoor, so someone is asking, can we skip suhoor but have a meal at 12 a.m. instead to have longer sleep to the morning and function better?
Okay, so this is an interesting question. So I probably would say no to that, because the reason is that the suhoor is there for a reason, the timing is there for a reason. If you are going to eat at 12 o'clock and then you're going to go to sleep after that, yes, you may have uninterrupted sleep, but you're also fasting for a much longer period of time. So, I would advise you to follow the sometimes if you saw, even for diabetics, what we're telling them is make sure you eat your suhoor as late as possible, to make sure, like, you are not going into hypoglycemia or feeling less fatigued. So I would ideally advise that, like, you don't do that. Have your suhoor at the time that you're meant to be having your suhoor. I do understand it is, it interrupts your sleep, but try and see if you can go to sleep earlier in the night, so you've got some, good quality of long hours of sleep before suhoor. And then, like, after suhoor, you can, like, catch up with a shorter nap or nap in the afternoon, do something like that.
And doctor, who should not fast in Ramadan?
So this is a good, well, in terms of who should not fast during Ramadan, well, there is a, people with like, let's say, like, pregnant women who are pregnant are advised against fasting, and I know they're also exempted in the religion from fasting. But then if they're guided by their doctor and they want to fast, I think they can fast, or as per the doctor's guidelines. And then the other thing in terms of fasting is, if someone whose blood sugar levels are not really under control, if their blood if they are really, really ill, they have recently had a surgery, people like that, like, who have conditions, where when they fast, it's going to have a negative impact on their health. So these are the people. Also, people with certain kidney diseases, they are not, they are being told not to fast. And the reason for that is about the dehydration and so on. So these are the list of people that I can think of. But others, everyone else who is healthy can fast. But anyone with a chronic disease, we really recommend that whatever information I'm giving is just the general overall information, because every person's individual circumstances is going to be different. So for you to make sure you check with your physician about your condition, and then they can advise you.
Good. And doctor, going back to healthy diet, can you please name some food which will boost our metabolism and immunity?
In terms of metabolism and immunity, again, I'm going to sound like a broken record in terms of saying, like, you need everything, like, a balanced, healthy, varied meal. But in terms of, we can talk about it, protein. There is a lot of research that's coming up now in terms of improving, your protein, because that is going to have longer satiety. That is, it's going to make you feel fuller for long periods of time. So protein is really coming up as to, like, something that we all should be consuming more of. So protein are things like your eggs and your chicken and your meat and whatever, lean meat and fish and legumes and lentils. So something like protein. In terms of immunity, again, it's a healthy, varied diet, but definitely your fruits and vegetables and fiber, because that's going to have, all those micronutrients, the phytonutrients, and, all of those things that will, all work together in terms of, like, giving you better immunity and health.
Good. And doctor, can you please advise on lifestyle modification for patient having GERD?
Patient having, sorry?
GERD, gastroesophageal reflux.
Reflex. Okay. Yeah. So in terms of GERD, I think, again, like, I would like to say that, like, you can speak to your doctor, but generally in terms of GERD, it is about avoiding, not going to, avoiding spicy food, making sure, like, you give enough interval, like, time between the time you have had your dinner and you're going to go to sleep, because I think sometimes people eat and then they go to sleep directly, and then that causes a reflux. Not avoiding wearing really tight clothes, and also most importantly losing weight if you are obese, because obesity is one of the reasons risk factors for developing GERD. So trying to lose some weight, these are some of the things that people can do for GERD.
Great. And doctor, regarding water intake, do you have any recommendation on water intake intervals? Drinking plenty of water along with iftar makes me feel bloated. So how can we ensure that we are drinking plenty of water from breaking our fast until suhoor time?
So, try not to drink. Yes, that's a good question. Try not to drink, when we say plenty of water, you don't need to take a whole bottle of water and chug the whole bottle of water at the same time at iftar, because sometimes that's what happens. When we say plenty of water, people, misunderstand and they think that they have to have a lot of water at one go. And that's what is going to help make you feel bloated. Try and drink water in sips or in small quantities, but make sure that you're drinking throughout the evening. So it's not, so if, it's not about drinking 3 glasses at one time. It's about drinking, for example, it's not about drinking 3 glasses at one time. It's about spreading those 3 glasses. So you drink 1 glass at iftar when you break your fast, 1 glass maybe after another half an hour, or you take regular sips of water during the day, because that would be a better way. And that will also help you avoid feeling bloated while giving you the hydration that you need. Also remember, as I said, that there are fruits and vegetables that have high water content, like your watermelon and your cucumber, and those also will give you the water that you need for your body. But in terms of drinking water, drink sips of water throughout the day.
And doctor, regarding drinking water, what are the signs of dehydration?
Feeling thirsty. So when you feel thirsty, that means you're already dehydrated. Okay. So when you think about dehydration, dehydration has many. There is mild dehydration, there is moderate dehydration, and there is severe dehydration. So it has different. There is a spectrum. But for most of us who are everyday lives, everything is okay with us, and we are going about our normal lives. By the time we are mildly dehydrated, I think feeling thirsty, your skin can be skin nails, they can be dry. These are some of the, your mouth feels parched. So even feeling thirsty is a sign of dehydration. And also when you do, use, when you do your urine.
No, the other one. Maybe same thing here.
Raymond?
Hindi lumilitaw yung meeting invite.
Yes, please, doctor, please continue.
Sorry, yeah. So the, so if you, when you go, you may not urinate as, it may not be as frequent, or when you do, you go for urine, your urine may be darker in color. It will not be pale, if you were not dehydrated. So these are some of the things that will let you know that you're dehydrated.
Great, doctor. And doctor, the concept of fasting. So does fasting have an impact on my sleep quality?
See, fasting may not have when you say on impact on your sleep quality, I'm not, when we saw the major health benefits, it has an impact on many other things, such as, your digestive system, such as your boosting your immunity, your brain function, reducing inflammation. So it is having an impact on all those things. So potentially through that, it will have an impact on your quality of your sleep as well. Going beyond fasting, one of the reasons that people are always told that give a little break from your last meal to from your dinner to when you go to sleep, it's because when you're going to sleep soon after having a meal, your body, your digestive system is busy, I think, digesting the food and so on. Whereas if you give it a break, then the food digestion has happened and the body is in more sense of, calmness for it to sleep. And that will have an impact on the quality of sleep. And even what somebody said about GERD, you're not going to have the reflex, you're not going to feel full bloated. Everything is clear for you to go to sleep. So I would probably say it has an impact on the quality of sleep, but through these other mechanisms, probably no research has been done specifically to look at it directly.
Great. And Doctor, last question for today. Do you recommend having 3 meals between dusk and dawn, or only 2, iftar meal and suhoor meal?
The recommendation that we have told is to have 3 meals, but that is not to say 3 heavy meals. I'm very cautious when I tell people this, because then it should not be that you have your usual iftar, you have your usual suhoor, and you're going to have a big meal in between those two. So try and reduce your meal sizes, but have 3 meals.
Great, great. Thank you, Doctor, for your input today. Thank you so much.
Thank you, Aisha. Thank you very much. And thank you to Asil and Dennis and Robert and everyone that helped to make this happen. Thank you all very much. And if you do have any further questions, I'm sure you can get in touch with Aisha, or you can email us at Abu Dhabi Public Health Center, and we'll be happy to respond to you. Thank you so much. Thank you.
Thank you, Doctor. Thank you, our audience, for joining us today. We encourage all members to participate in a series of fitness activities and challenging their friends and family to get active in Ramadan. Please follow us on our Instagram account at Dhaman Insurance to participate, and please scan the QR code for the survey. Again, thank you all for joining us today, and we hope to see you all soon in upcoming webinars. Stay safe and have a blissful Ramadan.
Thank you.